Let's take a closer anatomy-driven look at facial aging and the things that we can accomplish with structural filler, suture suspension, and facelift surgery. So when I think about a face, we first want to think about the structural components. The most important architecture of the face is the cheekbone or zygoma and the jawline or mandible. The bony prominence of the chin is also important, and then we think about the deep temporal hollows. When I think about the face, what I first want to think about is the anatomy underlying the tissue level changes that we're seeing. And we think about the cheekbone or zygoma and the jawline or mandibular border as the most important horizontal support buttresses of the face. When we look at signs of facial aging, we see, first of all, this idea of mid-face descent, where the malar fat pad is coming down. Next, we see jowling, or heaviness in the lower third of the face. Inferior to that, we begin to see laxity of neck skin, as well as vertical platysmal bands and horizontal necklines. We may also see some fullness under the chin, which represents excess preplatysmal and postplatysmal fat. And then looking closer toward the central face, we see heaviness at the nasolabial fold and piriform aperture, heaviness at the marionette line, dimpling in the chin, and a depression in the labiomental sulcus. When we look at the upper third of the face, we begin to notice changes around the eye area. So heaviness of the upper lid, periorbital hollowing in the lower lid, puffiness or herniation of the fat pads of the lower lid, and a little bit of fullness here in the medial fat pad of the upper lid area. Finally, in looking above this upper third of the face, we might notice rhytids of the forehead, glabella, and crow's feet, as well as brow descent, including lateral hooding of the brow. In some patients, we'll see forehead descent and loss of forehead volume. And these are the changes that we diffusely think about with the face. Facial aging is really a complex, component-driven approach to thinking about how we change over time. We lose bone density, we lose fat due to fat atrophy, we see weakening of the muscles, we see laxity of the skin, and we see loss of collagen and elastin. So it's a multi-layered structure that's changing all together simultaneously but in different ways. With a beautiful facial optimization approach in the operating room or the procedure room, we want to think about how to address all of these component structures in an organized fashion that respects facial identity but dignifies the changes that are happening at a physiological level. And that is my approach to surgery.